Nicole and Kara to speak about our recent blog we posted on the future of dentistry post COVID-19. And we are here just to be in a conversation of some of our thoughts and beliefs and feelings that we have about the future of dentistry and what we see happening inside of how we transition from how we did do things pre-COVID and where we are now, and then moving into the future, what is it going to be like for not only us as healthcare workers, but for our patients as well, and what are their expectations when they're coming into the office now, and what are their thoughts before they even think to come into a dental office? What are they looking for to know that it's a safe environment, not only for them, but for their family? And they're not only considering I'm coming in here for myself and protecting me, but what's around me in the environment that I might take home to my family. So there's all these cares and concerns and fears in the world that us, in the dental field, as, whether we work in the back office or the front office, or we own the practice or we manage the practice, whatever aspect of dental practice that you work in right now, it's impacting you. And it's impacting anybody and everybody because we're all one, and this virus isn't ending anytime soon. So we have to come from a standpoint of what's so now, where are we now inside of the circumstances that we're in the world, and how do we provide exceptional quality care to our patients, and what is needed and wanted on their end to ensure their safety, and what evidence are they looking for in your office to know that it is safe, and how do you prove that to them? So, big world of concern. We hear a lot from dental assistants and dental hygienists and front office over concerns, of I'm right in people's face, I'm right there, and feeling that fear of and anxiety of I'm putting myself into a position where I could get sick. And so we want to we got to come together as a community and talk out loud about the reality. There's a lot of fear out there of what this virus can do. And at the same time, the statistics of what it really is not as blown up as it is being accepted out in the community. So we want to be a resource where we can come together and kind of disseminate some of the fears out in the world, in our own community in the dental field, and come together and work as one team where it's like, we practice dentistry for this way for so long, and we wear our PPEs, we sanitize, I've got my mask, I got my Googles, I'm wearing my scrubs. And inside of that, maybe there were some things that were missing. Maybe there were some opportunities to be more sanitary, to have a full infection control program. There's ways in which a dental office can improve during these times in all areas, because at the end of the day, it will never go back to the way that it was. The pendulum swung forward. We are where we are. So what do we do now? So Nicole is our dental assistant instructor and director of education. And so she's been diligently thinking about the back office, infection control programs, how to really teach to the future of dentistry, these little baby assistants that are going to be coming into our program. And what fears might they have? Like, how is this going to impact healthcare in general, where people might be fearful of getting into the medical field and the dental field, and that stereotype that is out there that dentists, hygienists, those who work in a dental office were so highly, it's one of those top employment positions that you're in where you have high exposure, like any healthcare worker. And, there's real facts out there, and then there are false facts. And, we want to be the ones that are reporting the true facts and coming together and creating community where we're working as one, and also listening to the fears of our community. What are you afraid of? And rather than that stopping you, inside of this breakdown, this huge social breakdown that we're in with this virus, how do we cause a breakthrough? And what is the world telling us right now in what areas of dentistry we do need to cause those breakthroughs? And maybe it's not just infection control. Maybe it's an opportunity to take this time to slow down and look at how you're running your business and operating your business and coming from a more sustainable practice rather than from the practice of, always fighting insurance companies or, trying to get money from somebody. We could actually really look at this from a perspective of coming from nothing, which is what we are, because we are in the age of Aquarius. We are in new times. And how do we embrace those new times? And how do we empower one another inside of that to create something new and better? So Nicole, let's turn the time over to you and hear what kind of thoughts you have on the matter.
Yeah, I think one of the major points I want to bring up is infection control, because I know that just within our program, I've kind of restructured the way that I teach that, because it used to be just a quick go over, oh, this is how you sterilize, this is how you disinfect, really super simple. And now I'm going way more into it because the world is changing and everything inside of dentistry has kind of done a 180 turnaround, and everybody's seeing things through a different view, a different perspective of make sure everything's clean. Because if you can't prove that something is clean and you are following all of the CDC guidelines, you're not going to have patients. And that's like a huge breakdown inside of running a practice, is not having the patients to show up for, And I think that's where every single one of us in the dental community can look at what we can do better and how we can make sure that we can go home at the end of the day safe, and how we can make sure our patients are safe, because that's a major thing. I think one of the things that I'm going to very diligently go into is how to sterilize, how to make sure you're protected, making sure that everybody in the There we go. So making sure that everybody in that operatory who is in kind of the splash zone, you would say, or with the splash and the splatter of coming through like fillings or something like that, that they're safe. And I know a lot of dentists pre-COVID were not very diligent on their PPE. And so I just want to bring that to our program and bring that to our community and really like look at that inside of how to keep yourself safe, because it's not like anything we've ever seen before. You want to make sure you're wearing your mask, your glasses, and all of maybe even a gown, like a lab jacket. I know a lot of practices don't use those, but maybe that's something that everybody should start looking for and using. I know that in our course, I specifically got those when this all started to show them like, this is how you keep yourself safe. This is how you keep yourself clean. This is how you make sure your patients are safe and clean. And that is something that I'm really, really like strongly tied to, because I think that the only way you can keep the world safe is keeping yourself safe. And that is something that, especially when you're exposed to that many people in one day, you really need to make sure that you're doing the best you can do and not just saying, oh, that's good enough. So that's when I'm committed to teaching all of my, like Christy said, my baby dental assistants that are coming into this program and having fun and learning, but teaching them how serious it is and not just brushing over it and a quick week review, of keeping it in their minds throughout the entirety of the program and making sure that they truly comprehend how important this is. Because at the end of the day, your patients are trusting you. And the people that walk into your office are trusting you. Your teammates, your doctor, they're trusting you to make sure that you did your best job to make sure that everybody is safe, and making sure that you're wearing your PPE and that you're changing it out regularly and that you're not wearing the same mask all day long. I know we've all done it in being a dental assistant. I was a dental assistant for 3 years, and I know I would just wrap it around my arm when I wasn't using it, but we really need to start rethinking about that kind of thing of like, you can't just keep a mask on your arm all day. You need to be changing it out every single patient and making sure that that makes you clean, and make sure your dentists are clean and everything like that, and making sure your dentist has a mask on, because I know that's a big one. Throw a mask at them, make sure they're wearing one. But yeah, and then I know that that's mainly the one point that I have that I'm really really ready to teach and making sure that all our students have that in their minds.
That's great, Nicole. Kara, being a back office assistant and now transitioning to front office administrator, what do you have to add inside of that and all your years of experience?
Kara, did you want to take over and talk a little bit?
Let's see, hold on. Yeah, I can do that.
I think a big thing is, like you said, Nicole, you know, being myself an assistant for, gosh, I'm not going to say how many years. That's just not allowed. I don't know if I can count that far back, but, you know, long enough where, you know, back in the day, you know, the dentist was drilling and, you know, they're taking out amalgam and you have a mask on. But when you took that mask off and went home at the end of the day and blew your nose, all that amalgam came out. So it's an interesting thing, right? Because we don't realize just even wearing the mask, how much still came through. So even though we're inside the conversation of COVID-19, and yes, this is a virus, it goes deeper than just the virus we're in right now, right? Because at all times in the dental field, you know what it's like, especially as a dental assistant. You are splashing fluids all over you all the time. And, you know, it's not mandatory to shower and bathe before you go home, but it's kind of like, no, should I? You know, and thinking back all those times, you know, if it would have been available, it's like, oh, that's such a hassle. But if you're not wearing a jacket, if you're not wearing the lab coat, if you don't have the mask, if you don't have the googles, if you're not protecting your body, it's not just the situation of COVID-19 right now. It's infections, it's disease, it's viruses, it's bacteria in general. And in a healthcare environment, what is our responsibility to protect ourselves and protect our patients and make it as sterile and clean as possible? I think so. It is interesting in the conversation, you know, because we took advantage myself. I took advantage of my own well-being by not protecting myself for so many years. And now looking back thinking, gosh, like what could I have brought home to my family, my children, you know, and honoring myself in my life to say, I'm going to do what's necessary for me, which I think is a big part of this conversation that we're in right now, because a lot of, you know, hygienists and assistants are afraid to go back to work. They're afraid to put themselves into the situation of the fear, you know, which is understandable. And at the same time, we cannot let fear control us, because statistically what the virus is right now, it's, you know, it's, if we are healthy and taking care of ourselves and doing the things that we need to do and honoring our body and our mind and our soul, and those are all happy, healthy, and whole, then everything around us will be that way. So it's coming from the perspective of, what do I do for me in a positive way that not only impacts me, but impacts those around me, and coming from the view of, we are one, right? We are one. There's no escaping it. So, you know, and there's just something to be said about that, right? Great opportunity. Kara, what do you see changing inside of dental administration? You know, how do you know, we're inside of our courses, we take moment to moment every day. We adjust our courses based on the information that is coming to us inside of CDC updates, what's coming from our state and federal governments, what are the recommendations, OSHA, the ADA, and taking all of the data and saying, even us as a company, as an education center, we all come together as a team and we say, how do we protect ourselves? What are our policies and procedures, which is key, right? What are our policies and procedures that keep us safe and keep those who come into contact with us safe and into our environment? And so we, you know, as a company here, it's just the three of us here. And, you know, we diffuse oils and, you know, we keep a clean environment. We keep a mentally clean environment, a spiritually clean environment. And we're sanitizing and we're cleaning, not in a obsessive compulsive way where we're going to actually kill our own natural bacteria. right? There's balance in all things, and that's what we are here to teach, is that balance in all things. And how do you find that balance? So a lot of changes, and if we look at it, we can actually turn what's happening right now into a positive experience. And how do we build a better business and a better business platform, taking into consideration all views, right? All views of the relevant parties that participate in our business and our practice.
Mm-hmm.
What thoughts have you had, Kara, on how this might impact teaching for the front desk and dental administration?
Well, you do come in contact with the patients, obviously, front desk, checking patients in, checking them out. You hand them the clipboards and the pens, be wiping them down after each patient touches them. Wipe down your desk, your keyboard, your mouse, everything. Just keep in mind that germs spread quickly. And I mean, I know, and then hand sanitizer. Keep using your hand sanitizer.
And what do you think, we've been looking at different ways of, checking in, and how, for me, it's really about how do we take, ensuring inside our program, inside all of our programs, it's about ensuring that everything that we do, that we are able to effectively communicate, and we teach that effective communication in our programs to our students, such that they can communicate effectively with patients regardless of circumstances. So there's a certain language skill and set and mindset that we teach in all of our programs that give you the tools to overcome whatever there is to overcome, not only in your professional life, but in your personal life. It's really a matter of you declaring your own personal sovereignty, you governing you making the best decisions for your life. And how do we support that and encourage you, and the tools that we have available to you to excel in any area that you want to. And now is that time, right? Higher knowledge, higher education. We are in that age of Aquarius, and I talk about it all the time because it's if you look at it, it's an amazing time to be in, even though it doesn't feel that way. And if we all can come together and bring our energy into trusting what is happening, and being our own powerful being inside of that, making our own free will choices and governing our own lives in a way that move us up and forward rather than keep us held down, bogged down in fear. And that is what we teach, because you're going to have, inside a dental office, if you're a manager, you have staff who have fears. You have an owner, a dentist who has fears. You have the assistants and hygienists and fears there. So business isn't meant to be that we separate ourselves from communicating with one another. And business has ran that way for a really long time, where it was the top dog and nobody down at these bottom levels really knew what was going on in general. And now it's about transparency. It's being transparent. It's not about one person making all the decisions. It's about a company coming together and hearing the voices of the whole and saying, how do we take the collective voice of our organization and take all the cares and concerns and produce a product and produce a service that not only satisfies our needs as the individuals that make up the company, but also satisfies the needs of those who come to see us, right? And it is going to be more individualized. It's not going to be stacked appointments like it used to be anymore. People aren't going to come into a waiting room that has 30 other people in there, right? People are going to take more precision in their choices on where they go. And I can guarantee you, one thing that is going to matter most to them is, how are you as a dental office taking precautions to protect that patient? And how are you taking that, whatever policy and procedure you have created for your business model inside of the COVID-19 experience we're in, and ensuring patient safety and staff safety? And what are you going to do inside of it? Are you going to take the experience and take your team and create something new and then market that out to the public so that they can see it and it's evident that you care and you're being safe? That's what people are going to want to look for. The outside world is going to look at your practice and say, how are you protecting me? And then what evidence do you have? What do I see around me in your office that shows me you're protecting me? Mm-hmm. And how can you as an office be more socially engaged with your public through Facebook and social media, like we do here, where you're you put yourself out in front of your community and say, this is who we are. This is what we're doing. We love you. We care about you. We want you to be healthy. We also want to take care of your dental needs because it's so important not to let them go. Right. We know this, especially, somebody with periodontal disease. And then inside of that, there's all these opportunities for teledentistry. There are so many opportunities available inside of the circumstances we're in. Remote jobs, working from home, which will reduce overhead. So even though it may seem as though now is a downtime, there is a lot of opportunity for dentists, for practice owners, and for team members to come together and actually create an environment, create a business mm-hmm. that takes the collective, and the collective of that business is what drives the business, creates the business. And it's no longer about, an owner or a manager. There's no longer that hierarchy that one person says this is the way that it is and everybody follows that. That's gone. That won't work anymore. Right. Any other thoughts you guys have on this? This is a conversation and we welcome anybody to chat in. We will keep putting these out there as we build courses. We have a lot of content we've put together. We have an upcoming infection control program we will be releasing in June. There will be quarterly programs, quarterly trainings to help offices, which will be a huge aspect of the future. What is your infection control policy? Do you have one? Do you track it? Do you have a binder? Is it where you're doing sterilization? If the CDC came in and said, we're asking you questions, do you have something to show them that says, this is exactly what we do? And the same with your patients. They want to know, what are those protocols? What are those protocols? More so now than ever. Right. Even myself, being, have worked in a dental office for so long, owned and operated and ran, I was thinking about getting a cleaning and I was like, do I really want to get a cleaning right now? So even if I have those thoughts, and I know it's safe. So me being in the field for so long and still having that little fear from the outside world in coming in here, I know it's safe. I know that it's safe to come in. I trust the dental office I go to. I know they're clean. Yes, possibly they could be, could we take more steps? Maybe. Right? So there's so much to consider. And inside of it all, it's important that we don't take it out on each other. We don't bicker with each other, that we as a dental community come together here in Salt Lake City where we live, and that we bridge the gap between, I want to say the duality, right? We want to come into oneness. We want to bring the community together, and we want to say what's best for our community. What is best for who is here in Salt Lake City, right? Or Utah, where we live. And in all of our communities, it's about coming together smaller and building community forces and saying, okay, as a dental community here, what is it we want to see as a community? How do we come together as a community rather than having to struggle as these independent offices trying to figure it out. What if we all just got together and came together either online, through chat, and rather than coming from I'm right, my view's right, coming from what works, what will work in the future, what will benefit all, not just me. It's no longer selfish centered Instagram me, all about me. It's not that way anymore. It is about me and my personal choice and what I do in my life, and I own my choices, right? And what do I do with that out in the world, and how powerful is that out in the world, right? And we all have that within us to come together and honor one another and the beliefs and the views that the other person might have regarding the situation, and come in with compassion and understanding and communicate back through that compassion and understanding, where we know that that's just another version of myself talking to me, right?
Right.
And how do I love and honor that person? So that's a bit about what we are thinking of inside of COVID-19, and really wanting to bring out into the world and the community a conversation of coming from what's possible, stepping out of fear and stepping into faith, using this time and this opportunity to look at your business and actually tear it down and start over with a new foundation, and a foundation that's going to secure your future rather than repeat the past. So that's what we have for today. Nicole, Kara, do either of you have anything else to add to the conversation?
Nope.
No? Well, TGIF, right? It is Friday.
Right.
Is it Friday?
Tomorrow.
Is it Friday or Thursday?
It's Thursday.
Thursday, dang it. Okay, one more day.
Friday today if you want.
Did you play it Friday? All right. So we hope that all of you out there listening have a great day. We appreciate you tuning in and listening. And anything that you have to offer, we want to hear from you. We really appreciate hearing from our community, what's going on in your life, your world. What are you dealing with? What concerns you have? We do offer, I do offer professional and personal coaching. We offer consulting as well for businesses, along with our core programs. And it is a really great time to take a look if you're interested in consulting as a practice, or if just you as an individual are looking for some personal coaching. We do offer affordable packages and group coaching as well. So if I really encourage anybody that's listening to this, if anything resonated with you, if you've been thinking about, God, I'm stuck in this position and I'm trying to get out and I don't know how, reach out to us, even if it's in a message, like we'll message you back. We are here to really help grow the community, inspire the community, and bring something new into a space that it's just needed. It's needed and wanted, clearly. So that's it for today. We could go on and on. We wish everybody a happy Thursday, many blessings, and we will see you live here next week.
Bye.
Ciao.